Welcome to Doctors on Call. I'm Jenna Miller. We are well into the cold and flu season, but how do we know the difference between strep throat, the common cold, RSV, or even COVID? Obesity is a complex disease involving having too much body fat. Obesity isn't just a cosmetic concern, it's a medical problem that increases the risk of many other diseases and health problems. These can include heart disease, diabetes, high blood pressure, high cholesterol, liver disease, sleep apnea, and certain cancers. We'll tackle these issues and more on Doctors on Call with our guest, family physician, Dr. Tyrel Summers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Received his medical degree from the University of Kansas School of Medicine in Kansas City, Kansas. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Summers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Summers has been affiliated with Russell Regional Hospital since 2015. Thank you so much, Dr. Summers, for joining us again. And we got a lot to cover tonight, so let's start. Let's first start with, I know we got a lot going on in the air right now. What are you seeing patients for right now?
Yeah, so a lot of the illnesses that we're currently seeing are mainly like our viral pattern illnesses that we see day to day. A lot of like RSV, COVID-19, influenza A, influenza B, and then of course your normal common cold viruses, adenovirus, coronavirus, other types of just regular upper respiratory illnesses. Sprinkled in there, of course, we have people with chronic illnesses who are having exacerbations of those chronic illnesses. We're also seeing problems with people with like bronchitis and secondary infections as well.
Okay, so you mentioned the different influenza A, influenza B. What is the difference, and is it important to know the difference between the two?
Honestly, for like a normal individual, knowing the difference between influenza type A and influenza type B is not really important. It does influence a little bit in regards to treatment selections when it comes to a physician selecting which one to treat. They present a little bit differently in individuals. Influenza B typically tends to be a little bit more respiratory in its pattern, whereas influenza A tends to be more gastrointestinal, but they can kind of mimic and take symptoms from each other, so it's hard to say for sure. You definitely need to know the difference when it comes to testing for those things, but for the average patient, that really doesn't make that much of a difference.
Okay, and what kind of remedies would you suggest?
So for influenza specifically, there's an antiviral medication that you can take within the first 48 hours of symptoms that helps reduce both the severity of symptoms as well as the duration of symptoms. So early kind of recognition of influenza is really important. If you can't recognize it early via testing or via like exposure and getting treatment earlier, typically just symptomatic treatment is what's given. So medications to help reduce fever, to help reduce nausea if you have that, reducing cough with any of the medications over the counter that you would normally use to help with that is really critical and really important. Definitely taking care of your body in a way that would help promote your own immune system to fight off this illness, whether that be through good nutritional support, is crucial and important as well.
And when is it best to just stay at home, treat yourself at home, or when should a person take themselves to the doctor?
Yeah, so this honestly depends upon the individual because there's a lot of kind of nuances to patient care and knowing kind of your own body and what you need. For a lot of individuals that are healthy and just normal adult individuals, honestly, kind of staying at home and taking care of yourself symptomatically is important. You don't have to go out and about and expose yourself to others and kind of spread the illness. However, for individuals who have either an immunocompromised state, an immunodeficiency, or have some type of illness that would make them a higher risk for complications, getting early treatment and recognition of treatment is really important and really critical. Some of those individuals would benefit from early antiviral treatment. with medications that we now have for influenza, like I mentioned already. We also have early treatments for COVID-19, and they're even in the very early stages of recognizing RSV and getting a treatment for that as well. So eventually, getting earlier access to treatment for those individuals can help reduce mortality risk, can reduce morbidity risks. It can make a big, big difference for patients for sure.
Is there a way to know when you are no longer contagious?
The easiest way to kind of know for most general illnesses is to see that you're either fever-free for 24 hours without the use of medications to bring that down, or if your symptoms are starting to improve. Those two things kind of in studies have shown improvement. Now, I don't mean symptom resolution. Often people will have chronic issues going forward for upwards of 4 to 6 weeks in some illnesses. But for the most part, you can kind of tell when your symptoms are getting better. That's typically when the amount of viral transmission load starts to decrease.
Okay, you've mentioned RSV a few times. Explain what that is and what to look for.
Yeah, so RSV is an abbreviation for respiratory syncytial virus. It's a very specific type of viral illness that causes a form of bronchiolitis, which is an inflammation in the bronchial tubes that connect between the larger tubes in your lung and the alveoli, which are the air sacs that help exchange air through it. It causes a lot of cough and congestion, especially in the chest, and can cause really, really thick kind of secretions. It's very, very particularly bad in younger individuals, especially like kids that are less than the age of 2. But we've also seen a big, big rise in kind of risks associated with chronic conditions for people that are over the age of like 70. And so individuals who have like type 2 diabetes or chronic obstructive pulmonary disorder or congestive heart failure can end up with a pneumonia secondary to RSV that can be pretty devastating. It can be pretty bad. And so we try our best to get those individuals recognized early and begin symptomatic treatment earlier, and also too to look for secondary illnesses that can cause problems.
Sure. And we were talking before the show that the RSV season, if you will, is a little later this year than what it was last year.
Yeah, so we're seeing kind of a different spread of the RSV season when compared to our previous one. October, we saw a lot of RSV cases initially, at least in Russell County. And now we're seeing a little bit of a delayed cases now here in Russell that don't seem to be as severe as they were previously, but they could easily become severe, and it's still something that we need to keep our eyes out and close, especially if you have someone who's younger or someone who's older that's at risk.
Okay, now I think the fear behind COVID has settled down a little bit, but what do people still need to be watching for?
Yeah, so COVID-19, while now a lot of vaccinations have taken place, and so the risk of severe illness has diminished, that still doesn't mean that there's no risk when it comes to COVID-19. Very much like influenza used to be a very big killer in our world, and when we developed a vaccine that minimized, the same thing has happened with COVID-19. However, if you have underlying health conditions that make you predisposed to infection or predisposed to problems, COVID-19 can be a big, big, big problem for those individuals. The main people that I see biggest issues with are like in people who have pulmonary issues, chronic obstructive pulmonary disorder, asthma, because their kind of lung state to begin with is very compromised. And so COVID-19 often leads them to have exacerbations that require pretty advanced treatment, maybe even hospitalization. For those individuals that are worried about that, vaccination is really important if you can. And if you can't do vaccination, which not everyone can, getting prompt treatment with either an antiviral treatment or symptomatic treatment with your doctor is wise.
Sure. What's the difference between having a sore throat and actually having strep throat?
Yeah, so a sore throat can happen in a myriad of diseases. In fact, in RSV, in influenza, in COVID-19, and most upper respiratory illnesses, like a sore throat can be very, very common. It can happen in almost every single one of them. Streptococcal pharyngitis, which is a form of strep throat, is caused specifically by a bacteria that kind of grows in the posterior regions of the mouth and then along the tonsils as well. If you don't have tonsils, they can still grow in the tonsillar crypts. The area is there. And then it causes a very high fever. It can cause sore lymph nodes. It can cause problems with a lot of different things. And getting prompt recognition with either a strep test or evaluation by an advanced care provider can kind of get you set up very quickly for antibiotic treatment, which helps minimize kind of complications with strep. The primary one that we always worry about is strep can cause problems with kidney function if it's left untreated for a long period of time, and then can cause problems with kidney compromise if you're not careful. For the most part, though, individuals that have pretty good immune system are at very low risk for that.
Sure. Now, I'm sure you have patients come in and they're looking for a quick fix with an antibiotic and whatnot. When can you not prescribe an antibiotic to a patient?
That's a great question. So antibiotics are very, very challenging when it comes to being a physician or an advanced care provider when to give a patient them, because some individuals very early on in illness will likely progress and get worse if they don't have some type of antibiotic treatment or at least some type of intervention to be done. However, for most individuals, early antibiotic treatment is not beneficial because they normally have a viral illness. If that's the case, treating them with an antibiotic not only decreases their likelihood of getting better because you're not really treating the underlying source, but you're often hurting their bacterial gut flora. And that's a very, very crucial part of your own immune system. So you're taking someone and wiping out the good stuff that's supposed to be helping with the disease and helping with the process, and also kind of setting them back when it comes to making their virus any better. So antibiotic treatment typically for me, at least for my patients, is I typically say if things aren't getting better in like 7 to 10 days, that's kind of when you want to consider antibiotic treatment. One of the key hallmarks I always talk about is this process called double worsening, which is where a patient starts to feel better and then like a day or later becomes drastically worse. That's normally a sign that, hey, this was getting better, something got better, but then now something else has kind of come in and taken its place.
Now, can you have COVID and just have not known it?
Oh yeah, there's still a lot of asymptomatic cases when it comes to COVID-19, and that's the same for a lot of different viral illnesses anymore. For most individuals, though, they will have symptoms that they know about, whether it's even something minor like a simple runny nose or nasal congestion. But we do still have cases of asymptomatic individuals that just carry around viral illnesses. They have really healthy immune systems and don't necessarily have the same kind of disease response that other individuals would.
Sure. Now, what kind of suggestions can you give to help everyone watching maybe boost their immune system so they can try to prevent getting sick in the first place?
Yeah, so there's a lot of different things you can do to kind of help yourself during this time of year to minimize your risk for illness. So by far, one of the best things is trying to keep yourself as clean and sanitary as possible by using hand hygiene, whether that's soap and water, whether that's alcohol-based kind of cleaning things. Anything that has an antimicrobial kind of process is crucial and important. The next most important thing is making sure that when you know someone's ill, you're staying in or staying away from them as much as possible. That viral spread can be there. Taking good care of your body by getting good hydration and great nutrition is really, really important as well, because that helps set your body up for when you do become ill, that you can get better quicker.
Sure. Now we're 4 years into when COVID started. Have you seen, as a doctor, have you seen any lingering symptoms from those who have had COVID in the past?
Yeah, so I have a few patients who suffered from what we're referring to as like long COVID symptoms and long COVID processes, and they range from individuals who have problems with pulmonary fibrosis, a hardening of the lung tissue itself. We've had some people who still suffer from some memory kind of issues associated with what they used to call COVID fog or COVID brain. Those aren't nearly as prevalent, but they do tend to still happen, and we do still have people with. Primarily, though, it's pulmonary that we're dealing with a lot of the complications and side effects from long term.
Sure. So when they say, you hear that term, long COVID, when they're saying that, that means what you just described.
Right. Complications associated with the vascular and or damages that happen with a COVID infection. They don't always have to be pulmonary. Like people can have problems with blood supply issues or problems with strokes, other things that happen because of their body having COVID. So.
Sure. Now, before we get into our next topic, I would like to kind of transition by asking how important it is as far as what we eat to try to boost our immune systems, or how much effect that has.
So our immune system is a very, very complex thing. And even as like medical providers and scientists, we're learning more and more about how our immune system works every single day. We used to think that it was just these free-floating like cells that existed within our bloodstream that took care of all infections, and that's how they work. Now we're learning that our body has a huge microbiome that's also extremely important for our immune systems, that primarily is based within our gut and our gut health. That's why we've kind of made a push towards not giving as many antibiotics if we can avoid them as well. The amount of food that you eat has a big impact on kind of your overall health. Individuals that tend to kind of take things that are healthy for their body do a lot better when it comes to infection process than those who don't take care of themselves. We also know that those who have underlying health comorbidities that keep their comorbidities managed, like a type 2 diabetic patient who's doing a good job taking care of their diabetes, is at much lessened risk of getting a severe infection than those that don't do that. And that has a big play on kind of how your immune system is as well.
Well, there's some differing opinions out there regarding maybe more of a plant-based diet compared to more high protein, lots of meats. What's your opinion?
So dietary changes in an individual are all dependent upon that individual. As humans, we're technically omnivores, so we can really eat both meat and plants. There's none that has ever scientifically been shown to be more beneficial to others. The biggest thing that I tell people is that eating a variety of things is much more important than not. Trying to base yourself upon just one specific thing can be very, very harmful. So having a protein-only diet can be very, very bad. Having a carbohydrate-only based diet can be very, very bad for you. It's much better to kind of balance and do everything in moderation, for sure.
Sure. Okay, we're going to go to the phone lines. We've got Mary on the line from Hoisington. Hi, Mary. Go ahead with your question for Dr. Summers tonight.
Yes, I was wondering if it's okay to send my child to school if they have just a really small fever, no other symptoms. And then on the flip side of that, when I do have a sick kid, when can I send them back? Is the rule still apply for 24 hours fever-free with no meds?
Yes, thanks, Mary, for your question. You kind of hit the nail right on the head with the 24 hours fever-free without medication. That's been the standard that's been released by the Center for Disease Control to help mitigate kind of disease spread. Fever is technically defined as 100.4 or less. And so as long as your child is underneath that threshold, a low-grade fever, which a lot of people refer to as like a 99 to 100, it's safe to send them to school with that kind of a fever. But if they're running that 100.4 or higher, it's probably not safe to send them to school because of the chance of spreading on to someone else. And as a physician, I would feel comfortable, as I'm sure every other advanced care provider would, to provide like an excuse for school so that your child wouldn't have to participate in those cases.
Okay. Let's talk about what is obesity and what are the types.
Yeah, so obesity is a kind of broad spectrum kind of definition that we use as advanced care providers to discuss kind of the body mass index when it comes to an individual. There's different classes based upon the body mass index that an individual has, ranging all the way from class 1 to class 5, and the severity is kind of based upon that number. Body mass index is a very controversial topic. That's the one thing that makes it very tough because it's a standardized calculation based upon height and weight. But it was standardized based upon an older scale that we're now trying to reevaluate and say, hey, is this really the right way to be doing it? But for now, it's the way that we are trained as physicians. It's the way that we look at things. Anybody that has a BMI that's greater than 30 is considered to be obese. And that's varying degrees depending upon the calculation and how much they are over 30.
Sure. And what are the causes?
So obesity primarily is caused by overeating, over-calorie consumption. There can be other forms of obesity that happen for a number of different health reasons. Individuals who have insulin resistance, especially in those who have type 2 diabetics, tend to store a lot more body fat on their body, and so they can lead to obesity more than not. People who have like sleep apnea, we talked about at the opening of the show, are at higher risk for obesity and sleep apnea together because they don't have that right amount of metabolism because they don't get that full rest at night to reoxygenate their body to help burn fat more efficiently. And so they end up being obese, unfortunately. People who have cortisone-based issues or other endocrine-based issues can also end up having obesity as a side effect and consequence of those issues. So while calorie consumption is important, calorie consumption is not the only thing that tends to lead towards obesity.
Sure. And what are some of the complications that you see related to obesity?
So obesity has a ton of complications associated with it. In fact, every comorbid disease an individual can have, obesity tends to make that process worse. When it comes to like heart failure, we see higher rates of complications and higher rates of death associated with obese individuals compared to those that are at an appropriate weight. The same thing's true with type 2 diabetes. The same thing's true with kidney disease. The same thing's true with most other diseases as well. Obesity seems to make the complex medical management of a patient much more difficult and makes them at higher risk for those complications.
Is it true that metabolism slows with your age?
It's hard to say because that's mainly a genetic factor more than anything else from what we can tell. Some individuals have really good genes and their metabolism stays fairly consistent. The other hard thing to say is we really don't have a good way, Gemma, to measure metabolism. I can't look at you and say, let me grab this lab real quick and I'll check your metabolism based upon that. It's really just our kind of understanding of how much calorie in and how much calorie out produces your BMI that we have an idea of what your basal metabolism is.
Is there a way to change your metabolism?
Not necessarily, other than just changing the habits that you have. By far keeping yourself, in a moderate kind of diet, kind of calorie restricting a little bit when you're trying to lose weight, and increasing activity can make your metabolism a little bit better. But again, because we have such a poorly defined definition of what metabolism truly is, it's hard for us to tell you, yeah, you can increase your metabolism by doing this.
Interesting. Okay. Now, if a person is concerned with their weight, At what point should they see their doctor?
So talking with your physician anytime when you're concerned about your weight is really, really important. What I do a lot with my patients when they come in with concerns about weight is I get a calculator online that shows just calorie consumption and how much calories you need to have to lose weight, to kind of drive home the idea that, like, while exercise and all those things are extremely important for weight loss, calorie consumption tends to still be what we want to see to help minimize kind of weight gain or to help lose weight. So typically I'll get and sit down with them and go over those calculations and show them kind of where they need to be. It's a very, very easy thing to find online. If you get onto any search engine and kind of look up calorie calculator, it'll give you a age and give you your height, and then you'll put in your weight and your those things. And then it'll give you kind of an idea of how much calories you should be taking in and then how much calories per week you should decrease so that you can see weight loss. One thing is I really stress the importance of healthy weight loss. You can definitely lose a lot of weight very quickly by going on diets and restrictions that are very severe. But the truth is you don't really want to do that because it's hard to sustain. It's hard to keep that much weight loss. Doing something where you're shooting for about a half pound to a pound per week is much more obtainable and much healthier and easier for you to keep off in the long run, studies have shown. And so it's one of those things where you have to realize that it might take a long period of time before you see the transition that you're looking for, and a physician and a good dietitian can help you get those things.
Sure. Now you'll hear the sayings like, you can't outrun your fork, or, the 80-20, 80% of weight loss is what you eat, 20 is how you exercise. Is there any truth behind those?
Yeah, so there actually is truth behind that. The main way that we help people lose weight is by recognizing like what type of calorie consumption they have, but also to the quality of calories that they intake. One of my favorite references that I give to a patient, I saw on a TV show a long, long time ago, and that's looking at the calorie differences between a standard orange and a donut. The orange itself has the exact same calories as a donut would, but the difference is the amount of calorie that you get that's also fiber, that also has vitamins, that also has nutrients, is very, very high. So it's what we consider to be a very, very calorie light kind of item, whereas a calorie dense item like a donut that's just calorie, it's not really anything else, though they are delicious. Everyone loves a good donut, is not nearly as good for you in that regard than an orange would be, even though the numbers are the same. Teaching people those little kind of differences and those little changes can make a massive difference on weight. Another big thing I always drive home with patients is empty calories, calories that you consume in the form of beverages. Unfortunately, in America, we really enjoy soda pop, and it tends to have very, very high calories and high sugars that really just lead to weight increase, which kind of makes things a little bit difficult for patients. So I kind of say if you can cut out just little things, that makes big differences in the long run.
Of course. All right, we're going to go back to the phone lines. We've got Rosie on the line from Victoria. Hi, Rosie. Go ahead with your question for Dr. Summers.
I wanted to know what he thinks about all these drugs that people are taking, the Ozempic and stuff.
Yeah, thank you, Rosie, for your question, because I know it's a big kind of health change that's happened over the last 2 years, are these new medications that have entered the marketplace for weight loss specifically. She mentioned two ones by trade name. I think it was Ozempic and Mounjaro, I think is what she was trying to say. They're injectable medications that were originally given for people with type 2 diabetes. They work specifically on a peptide receptor that's on the body that helps your body basically use your own insulin a little bit better. They lead to weight loss because of that, but they also lead to weight loss because of the side effects that occur with them. They typically make people not want to eat as much and make them even kind of a little bit nauseated, or sometimes have problems with kind of diarrhea. And so that can lead to a person wanting to not eat as much. They're very successful in weight loss. In fact, data has shown they're very, very appropriate. The hard part right now is it's still relatively early, so we don't know a lot of long-term side effects and complications with those medicines. And then on top of that, we also don't really have a lot of access to those medicines. They're kind of in vogue now, and so they're harder and harder to find, and most insurance companies won't cover them except for patients who have type 2 diabetes, which is another thing. They tend to be more expensive because of that.
Okay, great question, Rosie. Now, talk about how often a person should weigh themselves. I know there's some differing opinions again about that.
Yeah, so weight, I always tell my patients, is just a number. While it's really, really important for us as physicians to be able to calculate those numbers and justify what we're doing with you to try to help you with weight loss, I encourage my patients not to check their daily weight. It just ends up leading to more frustration and more concern than not. Checking your weight at least every other week when you're trying to lose weight is important, or at least once weekly if you really have to, but I wouldn't do it much more frequently than that. It typically ends up with frustration and ends up with you feeling kind of bad about your weight loss journey. It's much more important to see how you feel. That's by far the biggest thing. Like, do you feel better today than you did when you started your journey, or a week ago, or 2 weeks ago? If all of those things are true and you do feel better, that's what we're going for. Oftentimes, even though we want that number to improve, really honestly, we should be looking at how do I feel, and do I feel better about what I'm doing right now?
Sure. We have just a little bit of time left. Let's talk about getting plenty of sleep, how important that is.
So sleep is crucial when it comes to all of the things that we've talked about tonight. Both your immune system and your body requires sleep in order to replenish and renew. Think about it as kind of getting fuel for your car. Your body needs fuel. Sleep is how we do that. And so getting good sleep is very, very crucial. As an average adult, you should shoot for between 6 to 8 hours of continuous sleep at night, and you want to get good quality sleep. If you're having any questions about your sleep quality and if it's good or not, talking with your physician or your provider about looking into that would be crucial. If you have a loved one that suffers from snoring, that suffers from difficulties with catching their breath in the middle of the night, or waking up short of breath, getting evaluation for sleep apnea or sleep quality is extremely important. And I would get you in to see a sleep study center as soon as possible, because the sooner you can change your sleep, the better it will be for your weight loss, the better it will be for your immune system. It's a good way to kind of tie this entire thing up for sure.
Excellent. Okay. Thank you so much again for being our guest tonight on Doctors on Call. That's Dr. Tyrel Summers from Russell Regional Hospital. Our next Doctors on Call will be discussing depression. You can email questions to our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.